When we decided the metrics for the project, I think that's where the close integration to all the interested parties started to happen. We brought together from the very early stages our clinical colleagues locally within our own trust, but also clinical colleagues from acute that we were hoping to deal with, of course with IM&T colleagues. So it was a really great opportunity to start things working together from the outset. We think from fairly early on the dashboard is going to be beneficial in helping us understand the differences in some of the performance standards across our region and across the NHS as a whole. We're certainly noticing, if we take, for example, the return of spontaneous circulation, within our area there are some marked differences, and it's great in being able to expose those differences and understand what makes one acute different from another acute. And with that information, of course, then we're able to do something positive to help all patients across the South Coast. Clinical dashboards for us are different. We have in South East Coast a vast range of information systems, some really complex and really well thought of information systems. Probably the best way of describing those systems is they answer fairly simple questions in a very sort of complex way. So a user can sort of assess all sorts of very complex information and get a very detailed answer. Conversely, what the clinical dashboard does for us, it answers very difficult questions in a very simple way, which allows us then to sort of socialise those performance metrics further afield, allows them to be digested by non-expert users, which for us is vital. Because it's such a simple way of looking at very complex data, we believe it's got uses pretty much everywhere. It's got uses simply in acutes, it's got uses at our PCTs, SHAs, even actually on the public internet sites. The clinical dashboard project, from the very early stages of its existence, brought all the clinicians together with all of the information teams and the IT teams, which in itself has had some really positive outcomes. I think although IM and IT used to do its best to try and understand the requirements of its clinical colleagues, I think now working together so closely has enabled future systems and future information tools that we produce to be that much more closely aligned to the real needs of the clinicians within this trust.